Knock knock, can I come in?
Yeah.
My name's Makenna. I'm going to be your nurse today. Perform hand hygiene. I would put on gloves. How are you doing today, ma'am?
Good.
That's good. I would put on gloves. I have gloves on while doing this. Can I check your wristband, please?
Yes, ma'am.
Can you repeat back to me your first name, last name, date of birth?
Makenna Sollenberger, 4/18/07.
Patient matches. Do you have any allergies?
No allergies.
All right then. I am here today because we are going to be inserting an NG tube because I have a doctor's order to do so. Is that okay?
Yes, ma'am.
Okay. We're going to get started. Gloves on. I would put the chucks pad over the patient so nothing gets on her clothes. I would raise the bed, lift the head of the bed to high Fowler's position, upright, straight up. Can you hold this emesis basin, ma'am?
Yes,
This is the emesis basin. Thank you. Just sit in your lap just in case anything spills. And I'm going to sit this cup of water right here for when we need it during this process. I have a syringe to aspirate, NG tube. I would open the NG tube packet. I would wrap this so nothing spills out of the other end. I would measure from the tip of the patient's nose to around the back of the ear to the tip of the xiphoid, and I would tape off this area, mark it with a Sharpie, marked. All right. I still have this clamp so nothing spews. All right. I would dip the tip of this about 2 to 4 inches into lubricated jelly. We are going to be inserting this NG tube into your nose. You may feel uncomfortableness. You may feel a cold feeling once I insert it, but it'll be okay. All right. Before this, I would figure out which nostril is the easiest to go into. I would ask the patient to cover one nostril, blow whichever one is the easiest for them to breathe out of. All right. I would insert this along the curvature of the nose, along the floor. If I hit any resistance, I would pull back, relubricate, and insert into the other nostril. Once this reaches the pharynx, the patient may have a gagging reflux. So this is when the cup of water comes into place. Will you hold this, please? And as I insert this, I want you to sip on the water, please, to help me guide this down until I reach my marked off area, which would be on the patient's nose. I would have tape readily available, and I would tape this to the patient's nose. All right. Okay. I would have this clamp so nothing spills out. This would be in the designated trash area. I would still have on gloves while I'm doing this. I would aspirate into the NG tube, pull back stomach content. I would check the color, make sure not a lot of blood is in it. I would test it, the pH and bilirubin levels. And then I would put the rest of the stomach contents back into the NG tube. Are you okay, ma'am? Okay. Then I would aspirate 5 to 20 milliliters of air. And I would have it ready. Put on my stethoscope. And as I would listen at the tip of the xiphoid, and I would insert the air and listen for a whooshing sound to make sure I have correct placement. I hear the whooshing sound. Syringe in designated area. Would still have this clamp so nothing spills out. And then I would connect it to a suction machine, whatever is in the doctor's order, that is where to connect it. Alright, this is connected. I would tape the tube to the patient's gown. Remove this. Tape to the patient's gown. Trash. Alright, are you feeling okay? Do you have any pain whatsoever? Alright, I'll take this and you can set this cup of water down. I would lower the bed in the lowest position. Lift the head of the bed back because they would be sitting upright. I would ask the patients if they need any of their personal belongings, make sure call light's in place, ask them if they need anything, the 5 P's. I would take off my gloves and perform hand hygiene. Make sure the patient needs anything. Do you need anything, ma'am? Alright. Just hit your call light if you need me, alright? Okay. Close the door.